Every day, pets across the country are rushed to the emergency room, occasionally with life-threatening illnesses and/or injuries. From toxins to foreign bodies to dog or cat fights and heat strokes, our fur babies can quickly find themselves in dire strait. What causes these emergencies? And more importantly, how can we even treat or even prevent them? Today, we're telling tales from the ER, as well as answering your pet related questions on this episode of Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome to Ask the Doc, the show where we encourage our viewers to send in their health-related questions. I'm Dr. Joy Carter, coming live to you from Veterinary Emergency Group in Fort Lauderdale. And today we're going to discuss all the things you need to know to recognize emergency situations as well as hopefully prevent them. Our first question of the day comes from Wendy, who reached out to us through our website, allhealthtv.com. Hello, Dr. Carter. The breath of my Karen Terrier Poodle mix, Bo, has a strangely sweet odor, which makes me think he could have diabetes. Can dogs and cats really get diabetes? And if so, what should we do? All right, thanks for reaching out, Wendy. That is a really good question. So yes, 100% dogs and cats can get diabetes. We do tend to see diabetes more in older animals, usually dogs and cats that are greater than 6 years of age. Also in cats, we do tend to see diabetes more in cats that are overweight. They tend to be more of an insulin type resistant type of diabetes, kind of like type 2 diabetes in humans, all right? Now, things that you want to look out for to see if your pet maybe has diabetes. Things that we typically tend to see is they drink a lot of water, they will urinate quite a bit. A lot of times they will have a increased appetite or kind of a ravenous appetite, and certainly they can have some weight loss also. They can sometimes have kind of a sweet odor to their breath, but we tend to see that more with a complication of diabetes called DKA, and I'll talk about that in just a second, okay? To diagnose diabetes, typically they need to have blood work and a urinalysis, all right? Usually what we see on blood work is going to be very elevated glucose levels. And then on a urinalysis, we usually tend to see glucose in the urine. There are some other tests like fructosamine and things like that that can be done, but usually those tests have to be sent out. But the hallmark test to determine if your pet has diabetes is hyperglycemia, which is high blood glucose, and then glucosuria, which is glucose in the urine. All right. So now, as far as treatment, okay, same thing within humans, diabetes is typically treated with insulin. There are a lot of different insulins out there. I'm not going to get into all that because that's kind of a topic for maybe another show, but there is insulin. Usually it is given twice a day, just like it would be typically, I think, in humans. Also, too, there is a little bit of controversy on this, but there are two new oral medications for cats. In particular, I think one is called Bexacat and the other one is Synvalgo. They are oral medications that can be only used in new diabetic cats. So the cat can never have been on insulin before, and they have to be otherwise pretty healthy. The reason there is a little bit of controversy is because it doesn't really help too much as far as them producing more insulin. What happens is the excess glucose is excreted by the kidneys. So some of these cases, unfortunately, can have some complications, and we call it euglycemic DKA that we've seen in the ER. Now, as far as what's going to be best for your pet, that is something that you need to talk with your vet about as far as determining if you have a cat, should they be started on insulin, or should they be started on that medication? A lot of times we're going to put the pets on a diet too. Okay, in particular, carbs are not that good when it comes to diabetics. Same thing in humans. Same thing in pets. So we want to typically put them on a low carb diet, okay? The best thing I can tell you is if you have a pet and is showing any of these clinical signs, okay, Wendy, you definitely need to follow up with your regular vet sooner than later, because there are two big complications that we can see with diabetes if it goes left unmanaged for too long. One complication is called diabetic ketoacidosis. It is a very serious condition that is life-threatening. Basically, what happens is the body thinks that it is starving itself because it has all this glucose in the bloodstream, and there's no insulin to tell the body to take this blood sugar out of the blood and to take it into the cells to be used as energy. When that happens, the body starts to break down fats. When your body starts to break down fats, it produces ketones, and too many ketones in the body is not a good thing. Basically, your body can become very acidotic, and if anybody remembers from chemistry class, there's kind of a certain pH range that is good for homeostasis, okay, in humans, and the same thing in cats and dogs. The other thing that can sometimes happen is something called hyperglycemic hyperosmolar syndrome. That is another serious complication of diabetes. That is when the blood glucose also has been very, very high for a long time period. That is a little bit harder to diagnose, but certainly we tend to see pets that come in that are very dull, depressed. Some of these dogs or cats can even be in a coma-like state. Both DKA and the hyperglycemic hyperosmolar syndrome, they can be treated, but they also can be life-threatening, and the treatment can be very, very expensive. We had a DKA case that was treated about a week ago. The final bill was about $15,000 for this cat to be hospitalized for a week. And this cat was very, very, very sick. So once again, I'm going to say it, guys, get pet insurance. Thankfully, these owners were able to provide the care and had the financial means to do it, but not everybody is going to be able to spend $15,000, okay? But with pet health insurance, that can help you out. So hopefully, Wendy, your pets are not having any problems, but if they are and you have any concerns, then definitely reach out to your regular vet, okay? All right. The next question is from Fawn, who reached out to us through our Facebook page. Hi, Dr. Carter. My husband and I just moved into a new apartment, and he wants to get some plants to warm up the place. But before we do, what are some house plants that are toxic to pets, and what should we do if our cat Trixie has a reaction to eating some of the leaves? Hi, Fawn. Really good question. I've kind of talked about this a little bit on the other two episodes. As far as toxic plants. All right. The number one toxic plant that we see with cats is going to be lilies. All right. Lilies are very toxic. Even the pollen can be very toxic. All it takes is just a very small amount of the plant, any part of the plant, even the pollen, for them to ingest it. The big problem with lilies is it can cause what we call renal or kidney failure. Okay. If you think your pet has gotten into a lily, or if you come home and you see pollen on your cat's face from a lily, you need to bring your pet into the vet immediately or to the emergency hospital, okay? Typically, what we're going to do is we're going to run some baseline blood work to see what their kidney values are. And we're going to recommend to keep them hospitalized for usually 2 to 3 days on IV fluids, all right? And we're going to recheck those kidney values every day. If those kidney values remain normal, then that's great. Then we send them home. All right. We actually just had a cat yesterday that got into the pollen from the lilies that we discharged, and she did really good. She's actually coming back today to get her kidney values rechecked. Other plants that can be kind of toxic is another one is poinsettias. You tend to see that obviously more around the holidays, Christmas time. Those tend to cause gastrointestinal signs. There can be some drooling, some vomiting, and some diarrhea. So it doesn't tend to be as severe, but obviously if you're concerned that your pet may have ingested poinsettia plant and they do seem like they're having any GI signs, you want to bring them in. I talked about this before. It's not really a plant you have in the house, but I guess maybe someone could. But it's sago palms. All right. They are very toxic and they can cause liver failure. All right. We see those specifically here in South Florida. So that's another one. Azaleas is another type of plant. Typically, those tend to cause GI signs also, vomiting, diarrhea, some drooling, things like that. Another plant, and please excuse me, hopefully I'm pronouncing this okay. It's called autumn crocus, all right? I don't even really know what this plant looks like, but you guys can go and Google it. It is another type of plant that can be very toxic. It can cause vomiting. It can cause gastrointestinal bleeding, and it can also cause liver and kidney damage. And then daffodils is another plant. It can cause vomiting, diarrhea, and abdominal pain, as well as if they get into very high doses of it, it can sometimes cause some arrhythmias, and it can cause respiratory suppression. So those are the main plants. There are a lot of plants out there, okay? And as veterinarians, we know about the most common ones, but we don't know about every single one. If your pet has got into a plant, the best thing to do is to call your regular veterinarian, or if they're not open, you're welcome to call us here at Veg. You'll speak with a doctor. We may get you to call the Poison Control Center. The reason why is they have information right at their fingertips, and they know all the plants and they know everything about them and what we need to watch out for. And a lot of times they will not only advise you, but they will advise us as doctors as far as what treatment needs to be done or if anything needs to be done at all. Okay. So keep those plants away from your cat, Fawn. All right. I definitely recommend probably having your plants outside is going to be the safest thing. But if you do want some plants inside, just do your research and make sure they're not one that's going to be toxic to your pet. All right, we got another Facebook question, and this is from one of our loyal viewers. This is Bethany. Greetings, Dr. Carter. My neighbor's bulldog Chucky found himself in the middle of a hornet's nest and got stung so bad that he had an allergic reaction that bordered on anaphylactic shock. Is that even possible? Pets going into anaphylactic shock. Hi, Bethany. All right, great question, and I really appreciate you reaching out to us for answers. Yes, a pet can go into anaphylactic shock, and it is just as life-threatening and just as serious as it is in humans. We do tend to see pets go into anaphylactic shock with more of our venomous type insects. So your hornets, your bees, your wasps, things like that, okay? I have seen some anaphylactic reactions to things like ants and some certain types of plants or other things like that, but that's usually not as common. Typically, signs of an anaphylactic reaction are going to be as a pet is going to all of a sudden be very weak. They're going to sometimes collapse on you. They're going to have difficulty breathing. They may have significant vomiting, diarrhea, things like that. If that is noted, you need to bring them into your vet or into emergency hospital immediately, okay? There is definitely treatments that we can do to try and get them out of this crisis and to get them more stable, but the sooner you can bring them in, the better, all right? A lot of pets, though, may not necessarily have an anaphylactic reaction, but they can have an allergic reaction to, say, a bee sting. And why it might not be as serious an anaphylactic reaction, it still, can be very uncomfortable and very painful. So typically with those pets, you're going to see swelling of the face, you're going to see a rash, you're going to see them breaking out in hives, you could see a little bit of vomiting, you could see a little bit of diarrhea. I definitely recommend if your pet has been stung by an insect to call your regular vet, okay? And especially if they're starting to show signs of a swollen face or rash or hives, you bring them in. We usually can give them a Benadryl injection or injection of a corticosteroid, which can help with all of that and help make them feel better. So best thing to do is if you can keep them away from the insects, but I know that's really hard because there's bugs everywhere. So hopefully that answers your question, Bethany. All right, and in case you missed it the first time, here's another opportunity to find out where to send in your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
All right, guys, our next question comes to us from Carlton, who just visited us on Instagram. Howdy, Dr. Carter. I just moved the family to Yuma, Arizona, which, if it's true, is supposedly the sunniest place in the world with the sun shining 90% of the time. Having said that, how can you tell if your pet is overheated and suffering from heat stroke? All right, howdy back to you, Carlton. All right, very good question. We unfortunately do get a lot of emergency room visits because of heat stroke. All right, we are in South Florida, guys. It's hot. I would say probably 90% of the time here. All right. So heat strokes are very common, unfortunately, and they can be very, very deadly. All right. first thing I'm going to say is, in order to try and prevent heat strokes, is you need to make sure to not walk your pets during the middle part of the day when it is the warmest. Okay, if you do have to do a walk in the middle part of the day, just make it a quick go out to the bathroom, bring them back in. Let's not walk around the block. We don't need to be going for a couple of miles, a jog, nothing like that. All right. As far as when it comes to heat stroke, signs that your pet may be having heat exhaustion or heat stroke can certainly be if they are having trouble like on the walk, if they are very weak, if they are panting very heavily, if they collapse in the middle of it, like those are all very, very serious signs. And obviously, if you feel that your pet is very warm, that's another sign too. If this happens, all right, I'm going to tell you what to do. You immediately want to rush your pet to the nearest veterinarian or to the nearest ER. Some things you can do in the meantime to help them out is you want to take cool water and you want to rinse them off. You want to wet that fur, okay? If you do have any ice packs, you can kind of put some ice packs on different parts of their body. You want to turn on a fan, or you want to get them in the car and you want to turn the AC on and you want to bring them in as soon as possible. Unfortunately, I have seen too many heat strokes that the pets had to be euthanized either because of poor prognosis or either they have passed away. I have seen pets come in with a temperature of greater than 110 degrees. At that point, the body is kind of like cooked, all right? The internal organs are fried. The brain can be fried. They can have serious complications such as clotting disorders, something called DIC, where they start bleeding out everywhere. Heat strokes, in some cases, they can be treated, but they need very, very aggressive treatment and it can be very expensive. A lot of times we're doing plasma transfusions. They're being hospitalized for multiple days on IV fluids, on GI protectant medications, because basically the whole body is just starting to shut down because it got so overheated. So the best thing that you can do is obviously prevent it. Imagine if you had to walk around at, say, 2 o'clock in the afternoon on a hot sunny day in South Florida with a fur coat on. Okay, that is not going to be fun. So just remember, all right, that your pets can easily get overheated. And that includes even leaving them out in like a patio that maybe has like no AC, but it's covered. They can still get overheated. Any of these brachycephalic breeds, those dogs, they need to be inside all the time and only need to be walked when it's cool in the morning or in the evening, right? All right, good luck, Carlton, with the move to Yuma. And hopefully you get a lot of sun, but not too much sun for your pets. Oh. And this question comes to us from Gabrielle, who reached out through our YouTube page. All right. Hi, Dr. Joy. Our dog ate a mango seed 2 months ago, which necessitated surgery to remove it. She was fine post-surgery, but now 2 months later, she's not eating and they want to open her up again. What do you think is the matter with her? Hi, Gabrielle. Without knowing or examining your baby girl, it's a little bit hard to say exactly what may be going on, but these are a couple of things. If your pet has ate a foreign body before, they can certainly eat a foreign body again. I see all the time repeat offenders in the ER. So that may be a concern that maybe your pet has ingested another foreign body. Now, anytime we go in and we do surgery, okay, particularly when we open up the abdomen and we have to open up the intestines or the stomach, part of the body's process of healing is to sometimes form adhesions. And adhesions is basically like kind of like organs sticking together, or with the GI tract, your mesentery, which is kind of like the spider web that holds your intestines and your guts together, can sometimes stick to that area where the incision was made in the intestines. And so sometimes an adhesion could maybe cause like an actual obstruction. I don't know exactly why they want to go in, but obviously your veterinarian probably has a good reason, and there's probably some concern that there is something causing an obstruction. Whether it could be due to an adhesion or another foreign body, I wouldn't be able to tell you that, but hopefully everything's okay with your dog, Gabrielle, and good luck. We've got another question from our website. This is allhealthtv.com. You guys should definitely go check it out. It's got a ton of useful information on there. And this question is from Shoshana. Hi, Dr. Carter. I'm getting ready to attend veterinary school, and I've got a question for you. Are certain breeds more prone to emergency room visits than others? Hi, Shoshana. Thanks for reaching out. This is an excellent question. All right. So this is kind of a list of the kind of top 10 dog breeds that are prone to major health issues. All right. All right. So our first one, this is your bulldogs, your English, your Frenchy bulldogs, your pocket pits that they're having now, your bully breeds, as they call them. Any of these dogs with a smushy, cute little face. They are prone to airway issues, in particular, something called brachiocephalic airway syndrome. What we typically tend to see with these dogs is they have a lot of times what we call cyanotic nares. So their nose, sorry for the sound, is kind of closed like that, so they can't breathe in air very well. They also tend to have an elongated soft palate, which is kind of a flap of tissue in the back of the throat. They can kind of flap around and get in the way when they're trying to breathe and cover up their airway. The other thing is that they can have what's called a hypoplastic trachea. So the normal diameter of their windpipe or their trachea is a lot smaller than what it should be. So with all that being said, they have trouble breathing in, they can have trouble breathing out. So these dogs are definitely more prone to respiratory issues, and obviously they're more prone to getting overheated. The second one is going to be our German Shepherds. All right, these guys are definitely more prone to hip dysplasia. They also are predisposed to some cancers, but we'll talk about that with another breed. As you guys probably understand, hip dysplasia is basically kind of osteoarthritis or degenerative joint disease of basically your hip joints. This can sometimes manifest when they're young as a puppy, or sometimes it can manifest later on in life. Very severe cases sometimes need to have surgery, such as a total hip replacement or something called an FHO, which stands for femoral head and neck osteotomy. Some cases that aren't as severe, we will put these guys on joint supplements. We will try and keep them at a lower weight so they're not so overweight and putting excess stress on the joints. And definitely, this is usually diagnosed by physical exam, being painful in the hips, and usually on radiographs, there's things that you can see in the hip joint that indicate that they've got that disease. Our next one is going to be our fun-loving golden retrievers and our Labrador retrievers. All right, these guys are so cute and they're always so happy, but unfortunately, these guys are prone to cancer. All right. There are different types of cancer that these guys are prone to, in particular, hemangiosarcoma, which is a type of cancer that can infect the liver and the spleen. Mast cell tumors is another one. Lymphoma, osteosarcoma, which is cancer of the blood. Those are the ones that we typically tend to see. Now, there is something really new and exciting out. There is a new blood test that has come out through, I think, a company IDEX that your regular vet may be able to do. It's called NU.Q. And basically, it's a blood test to try and test for some of these cancers early before you might see things on either blood work or on radiographs or ultrasound. So I definitely recommend, if you have a senior pet and it's one of these breeds that are predisposed to cancer, to talking to your vet about maybe getting that test done. All right, our next one is our Yorkshire Terriers. All right, definitely these guys are prone to tracheal collapse. I just discharged a Yorkie this morning actually with tracheal collapse. So what happens is your trachea, your windpipe, all right, has these rings of cartilage in it that help keep it open. With tracheal collapse, those rings kind of start to flatten out. And when that happens, imagine like a straw, okay? If you blow through a straw with it normally open, it's not going to make much of a sound. If you kind of squeeze on the straw and pinch it down, trying to either suck something up or blow it out, you're going to have difficulty and you're just going to make some weird noises. We tend to see with these dogs, we call it like a goose honking type cough is the most common thing. Sometimes episodes of tracheal collapse can be life-threatening and they can come in severe respiratory distress. So if you have a Yorkie Terrier, any of the small breed dogs, and they do this kind of honking cough, I definitely recommend you follow up with your regular vet. The best way to diagnose it is going to be with x-rays. All right. Fifth one is going to be Dachshunds, our wiener dogs. All right. These guys are certainly predisposed to intervertebral disc disease. All right. Everyone has probably seen the cute Dachshund that is like running around in a wheelchair. Well, it's cute, but it's not so cute for the dog. So what can happen in these dogs is that their disc is not made the way that it should be. And so it's more likely for their disc basically to rupture or herniate. And if it herniates or ruptures too much, it can put too much compression on the spinal cord. And that can certainly cause these guys to have issues with walking. They can be very painful. And in some situations, they can actually lose feeling and be paralyzed. If you have any concerns that your dog is having trouble walking, you need to take it to a vet immediately. Some of these dogs need immediate emergency surgery if they're not able to clear the back legs, okay? I don't think we're going to have time to go through the other 5 breeds, but hopefully we can do that again next time for you guys. But just to kind of quickly, like Dachshunds, I talked about that. Boxers are prone to heart issues, in particular, Shih Tzus and the smaller breed dogs can have dental disease. King Charles Cavalier Spaniels, they are definitely prone to heart disease. So I definitely recommend with those dogs that you have them regularly checked up by your vet. If a heart murmur is noted, then you definitely want to take them to the cardiologist sooner versus later. The other thing is Cocker Spaniels. There's something called progressive retinal atrophy, which is where they can start to lose vision. And the other one is your Great Danes, which they can have what's called a gastric dilatation of volvulus, where the stomach gets distended and it gets twisted. All right, I had to go through those last 5 really quickly, guys, but hopefully you got some useful information. So I appreciate you guys joining me, and I will see you guys next time. Bye.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.